This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 53 in a 58-part video series of the entire book. Please review our introductory video for background information on this revolutionary treatment plan. The subject is cholesterol and statin drugs. Cholesterol levels for successful heart failure recovery is a very broad subject that could take 400 pages to cover completely. To make it very short, very sweet, heart failure patients with low cholesterol have the highest rate of mortality. In one clinical trial, 3 out of 4 died for a survival rate of 25%. Heart failure patients with the highest total cholesterol live the longest, a survival rate above 50%. And that study by the UCLA Department of Medicine at the UCLA Cardiomyopathy Center, Los Angeles, is very surprising. Doctors, especially cardiologists, probably don't even believe these numbers, and yet that is the true science. Clearly, persons with heart failure do not want to lower their cholesterol unless they want to decrease their survival rate. Medications prescribed to lower cholesterol are the source of new cases of heart failure and worsening existing cases. The entire studies conducted over recent years confirm this. This is not the only study. Low total cholesterol is a definite signal of high rate of sudden death among heart failure subjects. In recent months, the entire cholesterol-lowering industry has been in the focus because all of this information that justified those medications is based on false statistical data. Any scientist who objected to the false premise that a diet high in cholesterol caused heart disease was ostracized and was not allowed to publish any findings. Most of the clinical studies supporting high cholesterol and heart disease were framed to test for components or lipids, not the entire cholesterol spectrum, but just components, in order to support statin medication sales. Rather than consume dozens of pages presenting clinical trials, facts, and figures, I recommend that you read the following book, The Great Cholesterol Myth, Why Lowering Your Cholesterol Will Not Prevent Heart Disease, by Johnny Bowden, PhD, and Dr. Stephen Sinatra, MD. The worldwide business of low cholesterol medication sales is over $35,000 million each year. That's 35 billion with a B. So follow the money. Those drugs are nicknamed statins. One of the side effects of statin drugs is heart failure. If you were taking a statin before your diagnosis of heart failure, then check a PDR, the physician's desk reference, available at any library, and check to see if that specific medication you were taking lists heart failure as a side effect. It may seem odd, but the FDA allows the sale of many medications that can cause heart failure. Discuss all risks with your doctors, then decide for yourself whether to continue taking statin medications. Death is a side effect of taking statins because they increase mortality from all causes, not just heart failure. 25% of Americans over the age of 45 are now taking statin drugs as a preventative measure against heart attacks and strokes. Yet statin medications have never been approved for treatment purposes. Yet since 2009, 900 studies have appeared to link dangerous side effects and increased cancer risk from taking statin drugs. Even Alzheimer's increases almost 50% in the presence of statin medications. Statins cause muscle damage, which includes heart muscle damage, and most statin clinical trials have excluded test subjects with heart failure that might show the increased mortality rate in that study. In the light of these scientific trials that prove the damaging effects on the heart, it is not advisable to take cholesterol-lowering medications. You must discuss this with your doctor. Statin medications are known for over 20 years to destroy and eliminate your heart energy enzyme, CoQ10. This is the most important metabolic enzyme for heart failure recovery. Without CoQ10, your heart energy from ATP declines drastically. You could theoretically continue taking a statin by increasing your intake of CoQ10 to compensate, as required by the Canadian government. In practice, it would be impractical because a statin medication is still trying to reduce your heart output, the very nature of heart failure. Statins also have a nasty tendency to destroy brain activity because cholesterol is the major building block for brain nerve cells. 15% of persons taking statins have experienced specific heart muscle damage, not including those that actually died. So this is a fairly blunt part. Read the books on cholesterol, the latest ones, the latest clinical studies, and the footnotes in this book. Do not give up your right to decide your course of medical treatment. Most of the doctors in the world medical community were fooled by the cholesterol heart disease myths. A rep from a pharmaceutical company will often visit doctor's office and claim clinical trials prove that there's an improvement in outcomes by lowering cholesterol. But the doctors have not actually read any such clinical trials. And if they did, some of them were actually fraudulent because they did not truly compare total cholesterol. They only compared specific components that can be manipulated. Well, that concludes this section. It could truly take an entire book twice this size, and many books are. I suggest that you read them and educate yourself. This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available on Amazon in print and Kindle editions, at the Apple iTunes Store in the iBooks edition, and on eBay in print editions. Also from the publisher, Wilkerson & Hughes, P.O. Box 777, Altoona, Florida, 32702. Just enclose a check for $24 for the book with handling. Thank you for listening.